Hollywood is all about looking perfect. You are paid to look perfect. If you weren't born with perfect features, help is on the way.
This is the classic lunchtime procedure.
What happens when it goes too far?
We call it the startled look of Bedford Dry. I've seen numerous times in the office, and I've seen also personal experiences with people that other people thought had procedures where we made assumptions and they weren't always accurate.
Just because Angelina's lips are full doesn't mean they're stuffed with collagen.
Everyone thinks she's had her lips done, but she hasn't.
There's some actresses out there, if you look back 15, 20 years, or you look back even in their childhood, they had large lips. And there's some of these actresses that people think that are always having injections, and I would question that with some of them. A lot of people in the entertainment business are driven by ego needs. They may indeed have somewhat fragile egos to begin with, and they may have a lot of other assets, but that may be an issue, in which case if there's a few things that are wrong, they may sometimes be magnified in their minds.
Today's many non-invasive procedures mean you don't have to disappear for weeks after the work.
Gosh, you can do it on your lunch hour now and just come back looking refreshed. You know, so it's so accessible, and therefore the public has a greater interest to see why somebody looks so good and what did they have done.
This is the classic lunchtime procedure, literally. Go right back to work. And it's really probably the only cosmetic procedure that has no delayed gratification. You walk out immediately looking the way you want to look.
Laser technology keeps improving, often replacing the scalpel.
Lasers have evolved from a blowtorch technique. There was the CO2 laser from 15 years ago that had a 7 to 10 day healing period, all the way down now in the last 2 to 2.5 years to lasers that improve wrinkles and in fact virtually get rid of them. Botox is the most widely known so-called filler, but it's not really a filler because what it's doing is it's knocking the muscle down.
Botox essentially is a neurotoxin that relaxes muscles that cause wrinkles, mostly around the eye area.
We call it the startled look of Bedford Drive. It's which is our street here in Beverly Hills. Yeah, sometimes the forehead lifts are, extreme. Sometimes the face is inappropriately pulled tight on somebody that really needs filling rather than tightening.
Celebrity surgery is there to help a star's career inside Hollywood. But what happens when it all goes too far?
You can have some unfortunate results, so that's the problem. I've always said that what we really need is a kind of a cosmetic surgery czar. And you go in, maybe it's the government, doctors don't like that idea, but, and you go in and you show what's wrong, and then they tell you what you should do. I had a patient showing me Halle Berry. The other was a model, and I wasn't familiar with it, but and she said, "This is what I want," and she showed me the model, and she said, "This is what I don't want."
The pressure to stay young is everywhere. That's why we'll always have celebrity surgery.